This lecture is titled Histology and corresponds with the course DA 140A Integrated Basic Science. After watching this lecture, you should be able to define embryology and histology, discuss the life cycle of a tooth, explain the differences between clinical and anatomical crowns, name and describe the tissues of the teeth, name and describe the three types of dentin, describe the structures and location of the dental pulp, name and describe the components of the periodontium, describe the functions of the periodontal ligaments, and describe the various types of oral mucosa and give an example of each. Oral histology is the study of the structure and function of the teeth and oral tissues. The first structure of the teeth that we will talk about is the crown. The tooth crown is covered with enamel. The dentin is the layer underneath the enamel. The anatomical crown is the portion of the tooth that is covered with enamel. The clinical crown is the portion of the tooth that is visible in the mouth. So you can see that there's a difference between the anatomical crown and the clinical crown. So again, the anatomical crown is the portion of that tooth that is covered with enamel. But the clinical crown is what is visible in the mouth. If you look at the picture on the top right, you'll see that we can see the enamel of the tooth on the top of the crown, and then you can see kind of a darker yellow section of the tooth. That's the root of the tooth. There is no enamel on that portion of the tooth. However, that is part of the clinical crown because it's what is visible when we're looking in the mouth. The CEJ is the cemento-enamel junction. This is where the enamel of the crown and the cementum of the root meet. So the root is covered with cementum, and so where that cementum and the enamel come together is called the CEJ. So it's kind of that line where the white enamel and the yellow of the cementum meet. The roots of a tooth are embedded in the alveolar process, which is the bone that surrounds the teeth. So the bone that makes up your jaw, that's called the alveolar process. The tip of the root is called the apex. So structures that are around the apex are called apical. So anything you find around the apex or near the apex is going to be called apical. And periapical means that it's around the apex. So in this photo, or it's an x-ray, you'll see that there's kind of this dark kind of circular section around the apex of the root. That's actually what we call a periapical abscess. So it's a little bit of infection around the apex of that tooth. So it is an abscess, but we call it periapical because it's around the apex. The roots of the teeth can have 1, 2, or 3 branches or actual roots. So that means that a root that has 2 roots is referred to as bifurcated, and 3 roots is called trifurcated. The root is entirely covered with a material called cementum. Remember, the enamel is what makes up the anatomical crown of the tooth. It is very hard and can withstand 100,000 pounds of force per square inch. It is translucent, so it's not white, it's actually a translucent color. It is formed by ameloblasts. Those are the cells that form enamel. And hydroxyapatite is the most abundant mineral component of enamel. The enamel consists of what we call enamel rods. They extend from the surface of the dento-enamel junction. This is a scanning electron micrograph of the enamel rods. In this photo, the dentin is a yellow substance. So the dentin makes up most of the tooth and is not as hard as enamel. It is covered by enamel on the crown portion, and it's covered by cementum on the root portion. So there's no cementum between the enamel and the dentin. The cementum only surrounds the root surface. And the dentin is a light yellow in color, and it can darken with age. The dentin consists of dentinal tubules, which each contain a dentinal fiber. The fibers that are in those tubules can transmit information to the nerve of the tooth. This is where cold or touch sensitivity of a tooth comes from. It's from these fibers that live inside of these dentinal tubules. This is a scanning electron micrograph of those dentin tubules. There are three major types of dentin: primary, secondary, and tertiary dentin. Primary dentin makes up the bulk of the tooth, and it is formed before the tooth erupts. Secondary dentin is formed after eruption. It is a slow process throughout the life of the tooth, and it narrows the pulp chamber with age. So it actually kind of fills in that pulp chamber as people age. Tertiary dentin is also known as reparative dentin. So this forms in response to irritation on the wall of the pulp chamber. So if irritation occurs, this tertiary dentin will then fill in. As we discussed earlier, the cementum covers the root of the tooth. It is bone-like and rigid, but not quite as hard as bone. It's formed by cells called cementoblasts, and it is light yellow in color. There's a lack of luster compared with the enamel, so it appears much duller when you look at cementum. Well, now we'll talk about the pulp of the tooth. The pulp is basically the life of the tooth. The pulp chamber is the inner portion of the tooth. When you look at this photo, you see the pink part. The whole pink part is pulp. But the part that's closest to the crown, the kind of like little square, little like cave in there, that is the pulp chamber. Pulp is made up of nerves and blood vessels that enter the tooth through what's called the apical foramen. So apical, apex. So down at the root of each tooth, there's a little opening called an apical foramen. A foramen is a hole. So through that hole is where the nerves and blood vessels come in and enter the tooth. The blood supply comes from what's called the periodontal ligament, which we'll talk more about later. Connective tissue in the pulp consists of cells and an intracellular substance and fluid. Fibroblast cells are what are responsible for formation of the intracellular substance. The coronal pulp is the pulp that lies within the crown and contains the pulp horns. So what's in the pulp chamber is the coronal pulp. The pulp horns are where the pulp chamber kind of tips up towards the cusps of the teeth. Radicular pulp is the pulp located more apically inside of the roots. An accessory canal can be present. It's not always present, but it can be, and it leads outward. You can see on the diagram there's a small little what we call accessory canal kind of coming off of one of the main canals of this tooth. And again, the apical foramen is the opening at the tip of the root where the nerve enters and exits the tooth. The periodontium is an umbrella term that contains other structures. So the periodontium consists of the alveolar bone, which remember that is the bone of the jaw that the tooth is in, the cementum, which is that outer layer of the tooth on the outside of the root, and the periodontal ligament. In this picture, you can see the periodontal ligament are these little purple fibers or ligaments that connect the tooth to the bone. They're divided into two major units, the attachment apparatus and the gingival unit. And we'll talk more about those soon. The alveolar process is an extension of bone from the mandible and maxilla, and it's what holds the teeth in place. It consists of the cortical plate, which is dense covering over a spongy bone. So it's basically the outer portion of bone that is very flat, like a plate. The alveolar crest is the highest point of the ridge. So it's the area in between two tooth sockets where the bone comes up higher. The alveolar socket is where the root of the tooth goes. So it's the socket or the hole where the tooth rests. The lamina dura is also referred to as the cribriform plate. This is the bone that lines the socket, and it's very thin, compact bone. Here's a larger image of the bone of the mandible. And you can see the different areas that we've talked about. Let's review the types of bone. Cortical bone is very hard and dense. Cancellous bone is the inside bone. It has what are called trabeculae. When you look at a radiograph, these trabeculae appear like very web-like little structures of bone. The cancellous bone is not as strong as the cortical bone because it is more porous and it has holes inside of it. This is a good image of the alveolar crest. The alveolar crest is that portion of bone that comes up between the teeth and comes up higher towards the crown of each tooth. The little arrows here point to the alveolar crest. Now let's dive deeper into the periodontal ligament and its fibers. The periodontal ligament has a number of purposes. First, it supports. It allows for pressures and forces of chewing on the tooth. It kind of acts as a little bit of a spring, so that when you're chewing, the tooth can kind of actually go up and down slightly in its socket. So it adds for support. It has a sensory function. The nerve fibers allow for a sense of touch. So when you bite down and there is pressure on it, that actually allows for that sense of touch. A nutritive function. The ligaments are fed through blood vessels, and that forms a nutritive function. Formative and resorptive function. The fibroblast cells permit continuous and rapid remodeling of the area. Within the periodontal ligament, there are many different fiber groups. The main fiber groups are periodontal fibers. These support the tooth in the socket. Transeptal fibers, which support the tooth in relation to other teeth. And gingival fibers, which support the gingiva that surrounds the tooth. Within the gingival fibers, there are some subgroups. The dentinogingival fibers go from the cervical cementum outward and upward to the gingiva. The alveologingival fibers go from the alveolar crest upward towards the gingiva. Circular fibers, which form a band around the neck of the tooth, and they are interlaced with other fibers. The circular fibers don't touch any portion of the tooth. They are just embedded within the gingiva. And the dentinoperiosteal fibers go facially and lingually, and their primary function is to support the tooth and the gingiva. This photo shows a number of those fiber groups and how you can see them on the actual tooth itself. You can see the dentinogingival fibers, which go from the dentin to the gingiva. You can see the circular ligaments, which are the ones that wrap around the tooth, the alveologingival ligaments, and the dentinoperiosteal ligaments. Now let's talk about the gingiva, or what we call the gingival unit. It is oral mucosa that is composed of stratified squamous epithelium. It contains ducts as well as salivary glands. There are three main types of oral mucosa in the oral cavity: lining, masticatory, and specialized. Lining mucosa is softer, moist, and can stretch. It makes up the inside of the cheeks, the vestibule, the lips, the soft palate, and the underside of the tongue. Masticatory mucosa is more rubbery. It makes up the attached gingiva, the hard palate, and the upper surface or dorsum or dorsal surface of the tongue. Specialized mucosa is on the top surface of the tongue or the dorsum, and it is what contains the papilla. Let's summarize the key points from this lecture. Histology is the study of the structure and function of tissues on a microscopic level. By understanding the histology of oral tissues, the dental assistant can better understand the disease processes that occur in the oral cavity.